Life is a precious gift, but it needs the support of a community to help it grow big and strong. A healthy mother and a strong hospital network with skilled staff and specialist equipment. A team that understands that even an ultrasound can become a lifesaver in the right hands. Every year, millions of women in Kenya never receive this precious gift simply because of where they live or how much they earn. But things are changing thanks to a partnership between the Kenyan Ministry of Health and GE Healthcare, which is helping to breathe new life into hospitals around the country.
When counties partnered with the national government, and we have GE, which signed an agreement with the national government, and the counties ended up signing an MOU with county governments. We've seen a lot of improvements because these great equipment have really enhanced service delivery in most hospitals within the country. And specifically, I'm going to talk about Kericho County, where health sector, and in fact, if you went to Kericho District Hospital, you will be surprised. It looks like any hospital in the West.
In the past, Kenya had a centralized healthcare system that put the majority of its skills and equipment in the hands of big hospitals in urban centers like Nairobi. And even if the equipment was available, the skills were lacking. Then, in 2015, the Kenyan Ministry of Health invested 38 billion Kenyan shillings in a healthcare transformation program and selected GE to modernize the radiology departments in 98 hospitals across 47 counties. Kericho Hospital, over 250 kilometers from Nairobi, is one of these beacons of hope.
We have state-of-the-art equipment at our level 4 facilities, and I want to zero in on Kericho District Hospital. We have C-arm, we have OPG, we have mammogram, and we have ultrasound. These have never been at any facility within this county since independence, and this is attracting patients like never before.
It's been good to work here with a new machine. For example, there's the scanning machine, because all mothers are scanned now at the due gestations, meaning that we are following each mother so that any obstetric emergencies we are able to handle and manage at the right time when they come to the labor ward.
For example, if I may just give one example of ultrasound, for the whole of 2015, we were able to see about 600 cases. And from January up to May of 2016, since we started using this equipment from GE, we have seen like 1,300. That's like 4 times the number.
The impact of this is that we have been able to introduce new tests that we were not doing before. For example, we used to refer patients to Eldoret, Moi Teaching and Referral Hospital for OPG, or the pantogram, which is a dental x-ray. Now we are able to provide the service locally. We are now able to screen for breast cancer because we now have a mammogram, a mammography machine. We are also able to do orthopedic surgery, and we are able to decide in theater that these patients, when we fix the fractures, we are able to actually get proper alignment as compared to before, where we would do an operation, send the patient to the ward. The following day, they go to the X-ray department for confirmation. And if the alignment is not proper, the patient goes back to theater. Now we've been able to stop that. We are able to confirm in theater, and therefore we are able to reduce the time and the costs on the patient.
The hospital has been able to realize revenue from that, because the high numbers of patients also translate to better revenue, which is able to run the hospital better in terms of even other services. So the quality of services offered in the hospital generally has improved, not just in the radiology department.
Quicker turnaround times, lower costs, and better service delivery to patients in rural areas. These are just a few ways GE Healthcare is making quality, affordable healthcare accessible to all Kenyans.
I want to show you a real life example
of the difference that the GE equipment has brought to the patients and to us as practitioners. For example, this image you're seeing on the screen is of a policeman who was involved in an accident, and he had a fracture of the left jaw. And he came for this examination and thereafter went for internal fixation, and the dentist was able to help the patient, and then the patient came back for another examination, and as you can see on the screen, that's an implant that was done to the patient, and the image shows that it was nicely done, and this is what we're able to achieve under this platform, and it is less than half the cost. If this had happened before the GE equipment were brought, this patient would have been referred to our national referral facilities, and it would have taken him almost 1 week to get the examination done. But now under this platform, it takes less than 10 minutes for this examination to be done.
And the beauty with this equipment from GE is that we don't have to manage, we don't have to sign any service contracts with anybody else. They do that. In case there's any breakage, they come and replace the equipment. They do everything. So our work is to just use the equipment.
GE is committed to creating long-term, sustainable impact in healthcare and is known for its holistic and multi-pronged approach to healthcare. That's why it puts skills training and transfer at the heart of every program. The GE Healthcare Skills Training Institute is proof of this long-term commitment to Kenya. As GE's first dedicated healthcare skills development facility in Africa, it will work closely with the Ministry of Health to train over 1,000 healthcare professionals over the next 3 years. It has already trained over 309 radiographers from 87 hospitals, giving them the skills and confidence they need to support and care for their patients.
We were able to get real-time training. Even though it was 6 weeks, we were able to grasp everything. It was hands-on. We practiced it on the patients. The tutors were up to date. We were even able to get the certificates. They gave us all the support that we needed. They taught us well.
When the staff, especially in the radiology department, when they use the equipment, their morale is really boosted.
This long-term investment in skills training and equipment is all part of GE's Health Imagination Mother and Child Initiative, our end-to-end solution that's reducing maternal and child mortality by creating sustainable models of healthcare for the bottom billion. The model doesn't just start with pregnancy and end with birth. It's a continuum that follows mothers into their homes and supports caregivers in their communities with smart technology and real skills at a fraction of the cost. This $6 billion commitment is already yielding a 15% improvement in countries like Kenya. But even these smaller projects in hospitals like Kericho are having far-reaching effects.
So what we are seeing is general elevation of healthcare in Kericho County because of the equipment that GE brought, and we are setting an example. For example, Unilever, they saw the quality of images we are producing from a digital X-ray machine that was delivered by Unilever. They followed up and found out the kind of equipment that we have. They went and contracted GE. GE delivered a machine to Unilever and it's being installed now. So basically, as we say, it has trickled down all over in the environment, that the quality of healthcare in the radiology environment has really improved.
As counties can get the best equipment, state-of-the-art like we have, there would be no reason why Kenyans cannot access healthcare in a manner that is efficient and cheap to them.
The project is still in its infancy, but it's already changing the lives of patients and practitioners alike. Perhaps in a few years, when the project is all grown up, we will truly know what a precious gift it has been.